All right. Good morning, everybody. Thank you for joining us for the Healthier Black Elders Lunch and Learn. My name is Sean Nurick. I am the research aide and outreach coordinator for Healthier Black Elders-Flint. And I'd like to introduce my colleague, Sarah Whitney, who is our all-star down at Wayne State, doing much of the similar things that we're trying to do here up in Flint. So I just want to start with a couple brief announcements of events that are coming up, particularly up here in Flint on October 28th. That's Friday from 10 to 3. There's going to be a health and wellness fair at Hasselbring Senior Center. They're going to have a number of vendors, health professionals, free screenings, vaccinations, medicine take back. And a guest speaker, Nurse T, who is just fantastic, just a wonderful, wonderful lady. And it's a completely free event. So if you're interested, please be willing to stop by. Hasselbring Senior Center is at 1002 West Home Avenue on the north side of Flint. All right. Another announcement. We're just going to start to announce this, but this is a little bit down the line. We are actually going to host another Lions tailgate watch party, obviously in the warmth of our community center. This is going to be held Sunday, December 4th. It's a 1:00 game. We'll start having people come in at 12:30. Come enjoy the game. We'll have a guest speaker. I was still working on that, and just enjoy a good time. We've had an absolutely fantastic response to our first event, so we're going to give it another shot. All right, I'm going to move backwards here. I'm going to pass this off to Sarah to give us our introduction to Healthier Black Elders. So, Sarah, take it away.
Thanks, Sean. I thought maybe we could lead off with our commercial and then I can fill in a couple of blanks. But thank you again, everyone, for joining us today. Again, this is the Healthier Black Elder Center Lunch and Learn. I think that we have a couple of new folks who are joining us. So we'll play a quick video that tells you a little bit about who we are and what we do. And of course, if you have any questions, you can reach us at our office. The phone number is 313-664-2616. And here's our video.
Did you know research studies bring about discoveries that can improve health and quality of life? And people of all backgrounds need to be included so that communities can trust and see themselves in the findings. Unfortunately, Black older adults in particular are not often invited to participate in research. We understand that people are mistrustful of research because of the abusive legacy of the Tuskegee study and the use of cells from Henrietta Lacks, among other examples. We're here to share with you that there are several safeguards in place to protect the health, safety, and privacy of participants, including older adults. All studies must be reviewed by a panel of experts at a university called an Institutional Review Board, or IRB. Then, studies that want to work with community members here in Flint can go through additional layers of review by non-medical community advisory boards to make sure they are moral, ethical, and confidential, that they obtain consent and provide clear information on the purpose of the study. Our Healthier Black Elders program in Flint and Detroit helps connect Black older adults with research studies approved by both the University Institutional Review and a community advisory board of Black older adults and aging agency leaders. Some of these approved studies provide compensation to participate. Each one differs, and researchers can tell you more about what their study offers when you sign up. We provide free programming on health and well-being hosted at local senior centers and online with tutorials on how to participate if you can't get there in person. A newsletter featuring community events and community member profiles, research studies and findings, and continuing health education.
Healthier Black Elders need you.
We connect you to research you can trust.
Research development needs you.
If you're interested in learning more about the Healthier Your Black Elders program in Flint or Detroit, you can visit us online at www.engageus.org.
Thanks, Sean. So again, that is a little bit about the Healthier Black Elders Center. And our goal is just to reduce health disparities through research and education. So as the speaker shared in the video, there are a lot of ways that we do that and a lot of fail-safes in there to help protect our participants. So if you're interested in learning more information, you can give us a call or visit the Engage Us website. And again, our number is 313-664-2616. And a big part of what Healthier Black Elder Center does is put on events like the one today, our Lunch and Learns. They are usually in person, and we have switched to virtual formats for the pandemic. We are slowly bringing ourselves back into in-person events, and those will continue more regularly in 2023. So before we begin with our main presentation, a few housekeeping announcements. Today's program will be recorded and you can watch it later on our website, www.mcuaaar.org. And if you have any questions for today's presenters, you can enter them into the chat box or into the Q&A box at the bottom of your screen. If you're joining by phone, you won't have this capability, but if you do have any questions that are answered by the end, you can give us a call at the center. Again, the number is 313-664-2616. To start off today's program, we have a couple of researchers here that are actually recruiting for active studies, and they will give a brief overview of what their study is about and how you qualify. So I will let our researchers jump in. Sophie or Lorraine?
Yes, hi everybody. Thank you for coming to the event today. So we work at the Electra study at the Institute of Gerontology at Wayne State. And we work with Black adults age 65 and above in the Detroit area, doing some cognitive research. So we are hoping to find better ways of diagnosing and identifying when someone is moving towards Alzheimer's disease, dementia, cognitive impairment. So we do a couple different things in our study to test for those. We do neuropsychological testing. So it's memory and thinking testing that's done on paper and pencil. And we do an EEG as well. So that's a device where we put a cap on your head. There's a lot of electrodes attached to that cap, and we measure the brain waves that are naturally occurring. It's non-invasive. There's no needles, no blood draws or anything like that. But we're always recruiting and looking for participants. If you're interested, our contact information is going to be included on the presentation that Dr. Kero is going to be giving. And I'll put it in the chat as well. I'll put our email and our phone number as well.
Thank you, Sophie. Okay, so again, the information will be available in the presentation. And if you have any questions about the study, you can give us a call after or put it in the chat. We will now move on to our main presentation. So today's speaker is Dr. Catherine Kero. Dr. Kero is a postdoctoral research fellow with Dr. Vojko Kaučić, and he is the lead of the Electra study that was just presented to you at Wayne State's Institute of Gerontology. Before earning her PhD from Wayne State's College of Nursing, she practiced nursing at Detroit Receiving Hospital. Her research interests include health promotion, disease prevention, and health equity for older adults and caregivers. Partnering with experts from diverse disciplinary backgrounds, she examines the physical, psychological, and environmental factors influencing cognition and behavior to determine the impact on functional abilities and well-being. We are so happy to have you today, Dr. Kero. Please take it away.
Thank you so much. I'm so pleased to be with you today. Thanks for everybody for making the time to join us today. I'm just going to share my slides. Oh, can I please have permission to share my slides?
Yes, give us just a moment.
All right, there you go, Katie.
Okay, thank you. Thank you very much. This will be a lot more interesting with some visual aids. All right, can everybody see my slides okay?
Yes.
Okay, fantastic. So thank you very much, Sarah, for the wonderful introduction and for the invitation to meet with this wonderful group today. As Sarah mentioned, my name is Dr. Catherine Kero. I'm a registered nurse and a postdoc fellow here at the IOG in Detroit at Wayne State University. And today I'm really excited to speak with you about a topic I think is super important to every single one of us, which is getting the best communication in our healthcare interactions. So we're going to talk about better communication for better health. But before we get into that, I just want to add to some of the information Sophie was letting us know about the Electra study as a whole. Our Electra study is a community-based approach for the early identification of mild cognitive impairment and Alzheimer's disease in the African American community. The reason that this research is so important to us is because we know that Black Americans are more likely to develop dementia, but less likely to be diagnosed or receive early treatment than white Americans. We think that a good way to address this gap is to find really easily available, easily administered, and reliable tests to determine the earliest predictors of cognitive decline. And we do that, like Sophie was mentioning, with some memory testing and some EEG or electroencephalograms. So if you are an older Black adult, age at least 65 years old, and you feel like you have some concerns with your thinking and memory, but do not have a diagnosis of dementia or mild cognitive impairment, please do get in touch. So here's just a couple of quick examples of what we do in the Electra lab. We have some computer testing. We use this EEG device. It's just electrodes exactly the same kind as if you've ever had an EKG of your heart, except with this, it's just sitting on top of your scalp, and we're recording brain electrical activity. The Electra study is done in partnership with the Michigan Alzheimer's Disease Research Center. So if you join us here at Electra, you also have the opportunity to be engaged with the Michigan Alzheimer's Disease Research. So it's kind of a buy one, get one free research deal. The only difference with the Michigan Alzheimer's Disease Research component is they do recruit participants with all levels of cognitive function, not just those who have healthy patterns of thinking and memory with some subjective complaints, but all levels of cognition. And as a benefit to you as a participant in one or both studies, we do provide feedback about your performance on the thinking and memory tests if you'd like. And we can also provide some resources to different community healthcare providers or resources that might be interesting to you. I'm also excited to share a little sneak peek of some more research coming out of the Electra Lab very soon. We'll be launching a pilot project called the GRACE study for greater resilience in aging through cognitive exercise. So this is an opportunity available to people who are enrolled in the Electra project, who are interested in different things that you can do to try to strengthen your cognition as you age. So it's not started yet, but if this is interesting to you, then I would strongly encourage you to go ahead and get started with the Electra project as soon as you possibly can. And I hope to share more about this project with you in the future. All right, and as Sophie mentioned, we have some contact information. If you'd like to get in touch with me directly, you can do so by email at catherine.kero@wayne.edu or just through the lab. I'm here in the lab as well, so the phone or the email for the lab. Okay, so let's get into the main topic for today, health literacy. We're going to start by first going over some definitions of what we mean when we say health literacy. I'm going to tell you about how this issue impacts patient outcomes. Then we'll have a little break for a quiz bowl challenge where you can do some self-assessment. I'll also tell you about some study results from a hospital-based survey that was conducted on health literacy. And to end, we'll talk about some different strategies that you can use to improve your communication with healthcare providers. So, what is health literacy? The World Health Organization defines health literacy as the ability to engage with health information and services. The Institute of Medicine here in the US conceptualizes health literacy as your capacity to obtain, process, and understand basic health information and services which are needed to make appropriate decisions about your health. So the most important thing here is that health literacy is not just reading. You can be an excellent reader and still have some challenges with health literacy specifically. So the three parts of health literacy are print literacy, oral literacy, and numeracy. Print literacy is a reading skill. So it's reading printed materials and understanding the implications of those printed materials. Oral literacy is understanding verbal communication about health. And numeracy is the ability to understand and make calculations with numbers that you might need to manage your health. It's a really significant problem. So it's estimated that almost half of the US population as a whole has some form of difficulty with understanding health information. For adults who are age 65 and over, it's estimated that about 2/3 have some difficulties understanding health information. And this is not surprising. Healthcare professionals even have to take special classes to understand all of the medical terminology and jargon that people use in the healthcare setting. But it is important because we know that worse health literacy does result in poorer health outcomes. So this can be misunderstandings about treatments. And then this increases preventable hospitalizations. We even see increased mortality rates and up to $250 billion a year in extra health costs that could have been avoided if we communicated better with each other. So as an example here, maybe you're someone who has just been diagnosed with something like congestive heart failure, and you don't understand exactly what's going on. It's something to do with your heart. It's something to do with your breathing. Maybe you don't understand the medications which have been prescribed, and the healthcare provider has not effectively communicated any warning signs or symptoms that you need to be on the lookout for an episode of CHF flaring up. So for this hypothetical patient, this individual gets discharged from the hospital, goes home. If they don't take their medications correctly or don't know the signs to look out for that their disease is getting worse, then they'll be back in the emergency room once again with the same problem. Not only is this detrimental to the person's health in the long run, but it's also costly. In fact, in the hospital, they call this the cycle of crisis care. So crisis care is people who are coming in for emergency treatments that really we could have addressed with preventative measures and better communication. So this is another one of those scenarios where it would be an ounce of prevention is worth a pound of cure. So how it works is essentially healthcare providers often overestimate how much of what they're saying is understandable to patients. And I mean, it's not a great situation, but it's understandable. Anytime you yourself are an expert in one particular hobby or area, or it's something you're working with every single day, you might be used to hearing some of the specialized language that goes along with that specific activity. Whereas somebody who's new to that activity wouldn't have the same understanding of the same words. It's also an issue because patients might not always speak up when they don't understand something that's being communicated. So we think that this could be because maybe people feel like they should be able to understand. Maybe there's some embarrassment happening, or maybe they're afraid of being stigmatized by a healthcare provider who they feel may be making a judgment about them if they ask for clarification. Regardless of the causes, these miscommunications result in poorer healthcare overall. So we need to find ways of communicating better. So here's a little example. This is a common enough finding that we see it every single day. It's even made its way into cartoons. So here we have the physician saying, well, yes, I suppose I could explain the test results to you in plain English, but then you'd know how sick you are. So the research that we did in the hospital setting was a nurse-driven initiative. So a lot of times nurses are the ones who are taking the time with the hospitalized patient at the bedside to review all of the recommendations. So the nurse has to make sure that the patient understands their medications, signs to look out for, and all of the other discharge information. And it can be very overwhelming. It's not ideal to do this in the 5 minutes before a person leaves the hospital when they're trying to gather their belongings and everything like this. So nurses decided that this was a really important topic that we needed a little bit more information about. So we created a survey. We measured in our hospitalized patients 2 different measures of health literacy. The first is called the Rapid Estimate of Adult Literacy in Medicine, the REALM short form. It's kind of a reading test for medical language. And then we also used something called the Newest Vital Sign, which is more of a math and calculations sort of test. And we think that both of these tests together cover all 3 of those different areas of health literacy. So the reading skills, the oral communication skills, and the numeracy or working with numbers skills. So now let's make this interesting. I would like to offer you all the opportunity to test yourself. So your answers can be totally private. Nobody's going to ask you to share. But I do invite you to take a moment, get a scrap piece of paper, something to write with, and we'll go ahead and try to go through these 2 questionnaires together so that you can get an idea about where you might stand in your understanding of health information. And if you know your basic level of understanding, you can maybe gauge how much or how little you should be focused on this problem when you have communications with healthcare providers. So hopefully everyone has something to write with. Let's begin. So for the REALM short form, I'm going to show you a series of 7 words. You can keep yourself on mute, but after you see the word come up on the screen, I would like you to actually try to say the word out loud. I'm going to give you a brief pause to try to sound it out, and then I'm going to pronounce the word as a healthcare provider would say it. After you hear my pronunciation of it, I want you to make a decision for yourself. If you were interpreting that word correctly, if you were pronouncing it the same way as a healthcare provider would, if you pronounce it like I do, go ahead and give yourself a point. If it's one that was new to you, don't give yourself a point for this one. We'll add up all your points at the end, and I want you to keep track of your score so that you can compare it with our hospitalized patients at the end. So hopefully everyone's ready. Let's get started. So the first word is pronounced menopause. Next word. The second word is pronounced antibiotics. The third word is pronounced exercise. Next is jaundice. the fifth word is pronounced rectal. The sixth word is pronounced anemia. And our last word is pronounced behavior. So, how did it go? Add up all your points. If you got at least 4 of them correct, congratulations. Your understanding of medical terminology is about the same as we try to have all patient education documents. So here, the emphasis is that this is the reading level in which educational documents should be prepared. We know that that doesn't always happen. But if you can say at least 4 of the words, pronounce them as a medical provider would, then it's a good indicator that you're interpreting medical words at a reading level that your education documents should be prepared at. All right, so the next one will be a little bit more interesting for you. This is the newest vital sign. This little chart on the side here should look very familiar. It's on every packaged food that we've ever purchased. This is the nutrition facts. And in this case, it's the nutrition information for a container of ice cream. So take a good look at this nutrition fact, and I'm going to ask you 6 questions. And you should be able to work out the answers to these questions based on reading this nutrition label. And again, I'd like you to go ahead and try to keep track of your scores. We'll go through all the answers at the end, and I want you to try to score yourself as honestly as you can to get a good idea of how easy or difficult this might be for you. So the first question is, if you eat the entire container, how many calories will you eat? All right, so looking at this nutrition label, I'd like you to try to work out, if you eat the entire container, how many calories will you eat? Okay, that's question 1. Next is question 2. If you are allowed to eat 60 grams of carbohydrates as a snack, how much ice cream can you have? All right, so now you're trying to figure out, you've got your little, you're gonna have a snack. You wanna keep it to 60 grams of carbohydrates. How much ice cream can you have? All right, question 3. Your doctor advises you to reduce the amount of saturated fat in your diet. You usually have 42 grams of saturated fat each day, which includes 1 serving of ice cream. If you stop eating ice cream, how many grams of saturated fat would you be consuming each day? So this one's kind of long. I'm going to read it once again. Your doctor advises you to reduce the amount of saturated fat in your diet. You usually have 42 grams of saturated fat each day, which includes 1 serving of ice cream. If you stop eating ice cream, how many grams of saturated fat would you be consuming each day? All right, we're going to move on down to the home stretch. So stay with me here, just 2 more. If you usually eat 2,500 calories in 1 day, what percentage of your daily value of calories will you be eating if you eat 1 serving? Again, question 4. If you usually eat 2,500 calories in one day, what percentage of your daily value of calories will you be eating if you eat one serving? Okay, I'm going to move on to our last question, and it's a two-part one. So, last question. Now, pretend that you are allergic to the following substances: penicillin, peanuts, latex gloves, and bee stings. Is it safe for you to eat the ice cream? One more time, question 5. Now, pretend that you are allergic to the following substances: penicillin, peanuts, latex gloves, and bee stings. Is it safe for you to eat this ice cream? Yes or no? And then why or why not? Okay, so I hope everyone has your answers written down. Let's go through the answers together and give yourself a score. So question 1 asked, if you ate the entire container of ice cream, how many calories would you eat? So to figure this one out, we need to know how many calories are in each serving. That's 250 calories in each serving. But this question wants to know, you finished the entire container. This is where they get you sometimes. So you look and at first you see 250 calories, but then you read the fine print that there's actually 4 servings in the little container. So you have to multiply 4 times the 250 calories in each serving. And in the entire container, you have a total of 1,000 calories. So give yourself a point if you got that one correct, and hold off if that one tripped you up a little bit. Question 2. This was the one about the grams of carbohydrates as a snack. So for this one, you have to scroll all the way down the nutrition facts and find where it says total carbohydrates. If anyone here is managing their diet for a special condition like maybe blood sugar or something like this, then this process is probably pretty familiar to you. But for the rest of us, it gives us a little insight in what people who manage these dietary conditions have to go through for each snack. So we're trying to get a snack that's 60 grams of carbohydrates. And in this nutrition label, one serving has 30 grams of carbohydrates. We can have double that in a snack. So we can have 2 servings. 30 times 2 would be 60 grams in a serving. So then you go to your serving size, half a cup times 2 servings. You can have 1 cup as a snack. So give yourself a score for this question. Question 3, this was a long one. The important information in this question is about reducing saturated fat. You know that on a daily basis, your total is 42 grams, and now you're going to go on a diet and get rid of the ice cream. So your 1 serving of ice cream a day is now taken away from this 42 grams total. So you've got to look through the nutrition label. You see the total fat, skip that, go on down to the SAT fat. This exciting little abbreviation here stands for saturated fat, 9 grams in 1 serving, 42 grams total. Take away the 9 grams for your ice cream free diet, and you're left with 33 grams of saturated fat in a day. So score yourself for this one, and we'll move on. So this is our percentage question. Normally you have 2,500 calories in a single day. And we're asking you to figure out what % of your calories would be coming from one serving of ice cream. So you take your 250 grams in one serving, divided by your total of 2,500 in a day, and you're left with 10% of your total daily calories in a half a cup of ice cream. And our last question was about food allergies. So the question is, would it be safe for you to eat this ice cream if you have allergies to penicillin, peanuts, latex gloves, and bee stings? The answer is no, because you have to scroll to the ingredients and you see that this ice cream contains peanut oil. And so that would be not safe for someone who's allergic to peanuts. So not safe because it contains peanut oil. So if you take a minute and add up your scores, the way we can interpret these scores overall is that if you scored at least 4 out of the 6 questions correct, you're doing very well. We would suggest that you probably have good health literacy. You probably are have the capacity to make informed decisions about your healthcare and follow basic recommendations from a physician or healthcare provider. If you scored less than 4, so 0 to 3 points, then you maybe haven't had as much experience with this sort of health literacy skills. And I would encourage you to make sure that you're taking time with your healthcare provider. You're somebody who might have a higher risk of ending up misunderstanding something that your physician is asking you to do. So we can move on briefly to talk a little bit more about what the research showed us from hospitalized patients. So the people who participated in our survey were in the hospital for a variety of reasons and were taking a number of different types of medications. The average age of people in this study was about 53 years old, but all sorts of ages were represented in this sample. Most of our hospitalized patients had roughly a 10th to 12th grade high school education level, although some had more and some had less. For our hospitalized individuals, the average score of the Realm short form, the reading medical words test, was 4.8, so 5 out of 7. For the newest vital sign, that nutrition label, the scores were substantially lower. So the average score for the newest vital sign was only 2.2 out of 6 correct. So here's how the different score categories broke down. So if you remember, for this word recognition medical terminology test, we'd like you to have at least 4 correct if you want to interpret most of the medical education documents. And you can see here that a large number of people who are in the hospital were not reaching this 4 out of 6 correct. So a pretty substantial number of folks are being left out by a lot of the healthcare education materials that patients are given. The newest vital sign was a more complicated test. So here, we would like people to have 4 to 6 points to be making, to really have experience in doing some of these math calculations for healthcare. And you see that the vast majority of people who took this in the hospital setting were not at that level. So physicians and all other healthcare providers should take this information to reinforce that we need to really explain things more clearly and have, and also patients should take this information to remind yourself to pause and ask questions and don't feel embarrassed. It's pretty much the vast majority of patients are in the same boat and do have some trouble understanding some of these medical medical issues. So in the hospitalized patients, we did find that older adults tended to have lower health literacy scores. People who had some alterations in their cognitive state also had lower health literacy scores. And our psychiatric patients really had trouble with the cognitive state, the word reading, and the newest vital sign. We found that people who were taking medications that are called antipsychotic medications did have significantly lower scores on interpreting that reading level than any other group. And surprisingly, we found that people who had pain that was being treated with opioid medications actually scored higher on the reading, medical reading test than did others. So maybe we can say that perhaps people whose pain was adequately managed were able to focus and understand some of this health information better. People whose pain was not being managed maybe struggled a little bit more. On the medical word reading test, the most commonly missed words were jaundice, rectal, and anemia. And for the nutrition label test, the most commonly missed questions were the daily saturated fat. This one was tricky because we tested numeracy because we asked you to subtract one serving from the total. Plus, it was a bit of a reading test as well, since saturated fat is not even spelled out completely on the nutrition label. You kind of just have to know that that's what it stands for. The next most commonly missed item was number 4, the percentage of your daily value of calories question. And this was a numeracy question for calculating percentages. So we think that maybe some people were just intimidated about trying to calculate out those percentages without a calculator. That could explain why that one was a bit of a challenge for folks. Out of all of the people who were eligible to participate and invited to participate, 31.5% did decline. And of course, this is reasonable. If there's a hospitalized patient who's just not feeling up to it, of course, that's reasonable. But there's also some explanation that perhaps some of these patients refused. Maybe there was some fear of exposing a weakness or a vulnerability in some of these reading skills. There were also some creative answers that were given. For example, in the newest vital sign, the nutrition facts questionnaire, we did find that there might have been some guessing going on. For example, someone could say, yeah, don't eat the ice cream, but they weren't able to provide the reason. The reason being that there was the peanut oil that one should avoid if they're allergic to peanuts. There was also a very creative answer from one particular gentleman who suggested it's not a good idea to eat the ice cream given that list of allergies because ice cream is known to attract bees. And if you're allergic to bee stings, you want to avoid that. So as far as I'm concerned, that's extra credit for critical thinking, but that's not the way the test is scored, unfortunately. When we compare the scores that we observed from the hospitalized patients with other types of scores that people found out in the community, we found that the scores in the hospital were quite a bit lower, but within the same range. So from this, we can say that people who are in the hospital obviously have other circumstances going on that makes it even more difficult than usual to understand health information. But at the same time, people who are not in the hospital also struggle to understand health information. So we recommend that healthcare providers and patients use universal precautions with health understanding. So what I mean by that is never assume that what's being said is being understood. Always double check. There were some limitations to the survey we did in the hospital setting. It was a single site, so it's only one single location. We didn't include any sort of consideration for health status or other circumstances that the participants had going on. And we also recognize that all of the tests we ask people to take do rely heavily on the ability to read. So it might be possible that people who struggle with reading overall would be able to understand some more visually interpretable sort of education materials. But at the same time, it's a valid test of health literacy because so much health communication does happen with printed materials. So now that we have thoroughly discussed the problem, and hopefully everyone here has some kind of understanding of where you personally might stand on this issue, let's talk about some recommendations for how to make it better. My first recommendation, I'm gonna name this one the phone a friend option. So it's called phone a friend because I'd like you to remember to use your phone for two different purposes. First, if you're going in for a healthcare provider visit, it's really helpful if you can list out ahead of time your top 2 or 3 topics that you'd like to cover in that visit. So this really helps for 2 reasons. First, you won't forget your most important thing. And second, I'm asking you to limit it to 2 to 3 topics, because if you go much beyond that, your healthcare provider is simply not going to have enough time to give you a deep and meaningful explanation of a whole litany of topics you'd like to cover. If you have more than 3 topics you'd like to cover, I strongly encourage you to make multiple appointments so that each topic can be addressed to the full extent. Phone a friend is also an option in the literal sense, to bring your phone with you if you cannot bring a family member or a friend or anyone like that to the health visit with you. I invite you to consider asking your physician or healthcare provider if it would be okay to phone a friend at the end of your visit. So they would probably not necessarily want to be on the phone for the entire visit, but at the very end, if the physician could just give you a quick summary of the most important things that you discussed, and you have an extra set of ears listening in, that can be really helpful. Not only will you double your chances of remembering all the details, but an external person might have a different perspective on some of these health topics than you in the moment might think about. My second recommendation is that you try to frame all of your healthcare communications within this Ask Me 3 strategy. So this is a way of streamlining all of the health information into the most basic and important pieces. This can be important if you have a healthcare provider who is a little long-winded and might tell you all of the information on all possible points of your condition. And that's fine, but I also want you to have the 3 most important points really, really clear. So Ask Me 3 is 3 questions. The first is, what's my main problem? Second question, what do I need to do about this problem? And third question, why is it important for me to do this? So let's give an example. Let's imagine a patient who has been newly diagnosed with diabetes, let's say. And they're talking about the pancreas and the cells and the circulating hemoglobin A1C and all of these complicated topics. Before you leave that appointment, I would ask that particular patient to say, what is my main problem? The main problem is blood sugar. 2, what do I need to do about this problem? You need to monitor your blood sugar, take medication, and look out for signs of too high or too low blood sugar. 3, why is it important for you to do this? It's important to follow those recommendations so that you keep healthy in the long term and in the short term, so you don't end up in a crisis that could result in either hospitalization or even death. It's very serious. So once again, I know it's redundant, but I think that this is the most important strategy you can bring with you to healthcare communications. Number 1, what's my main problem? 2, What do I need to do? And 3, why is that important? And my last suggestion is that you use the teach back strategy. So let's say you had a healthcare provider who answered all 3 of the main Ask Me 3 questions. I invite you to check your understanding by teaching back the same information that your healthcare provider just gave you, but use your own words for it. This way, you can check that you actually have retained and understood everything that the healthcare provider shared with you, and they can check back that what you heard is what they actually meant for you to understand from the communication. So teach back just means, okay, doc, I think I understand what's my diagnosis and what I need to do. Let me just check my understanding. First, I have problems with my blood sugar, and I need to check my insulin and my blood sugar levels with every meal, and I need to look out for feeling cold and clammy or hot and confused. And if I have any of those things, I need to check my blood sugar and get it back into a normal range. And then the physician might say, oh yes, that's exactly it. But also in your specific case, I want you to never buy orange juice because it has so much sugar or something like that. It's just a really helpful strategy to make sure that the communication is being given and received in the same way it was intended. So it's a double check strategy. So bottom line, most hospitalized patients and people in the community overall do have some difficulty with health communication. The good news is you can make a difference. And I recommend that you ask your healthcare providers about these 3 main topics. First, phone a friend, bring your notes or get somebody on the line. Second, use the teach back method. So repeat back in your own words all of the important points that a healthcare provider has emphasized to you. And third, remember Ask Me 3. What's my main problem? What do I have to do? Why is it important? So before we open it up for questions, I have 2 more slides that were requested. So we've been talking about good communication with your healthcare provider, and some folks have been asking about the best way to go about finding a good match. So this is a complicated question to answer because the way the healthcare system works, the answer is different depending on how you get your health insurance. Because of this, I would strongly recommend that if you're trying to find a new healthcare provider, your first stop is to talk with your insurance provider, your insurance company. So if you're looking for a new healthcare provider, I recommend that you look at the back of your insurance card and find your customer service phone number. Give them a call, plan some time, because these things often require waiting on hold for a little bit of time. Make yourself a nice cup of tea or something like that. And then every healthcare provider will have resources available for every health insurance provider will have resources available for which physicians or other health services are within that network, which ones are going to work the best with your specific insurance setup. Another approach is personal recommendations. So ask around. Ask your family and friends if they've had a very good experience with a physician, if they would be willing to share. And then get on the phone with that physician's office. The office staff will be able to help make sure that your insurance is a good fit for their office. Another way to get personal recommendations is by searching online. A lot of times people will either leave reviews, or there's also something called the health grades that are surveys people occasionally get to rate and review their satisfaction with the care from a specific physician or other provider. The only caution I would have here is that if you're looking at reviews online, please keep in mind that sometimes the loudest voices are the ones who have had an isolated bad interaction with a healthcare provider, especially in a circumstance where someone is dealing with a very stressful or discouraging health condition. You know, sometimes it's hard to separate a bad diagnosis from a good doctor. So do take those sorts of reviews with a grain of salt. And the last recommendation I would have for you is to maybe seek out a healthcare provider with some specialized training. So for example, a geriatrician would be a really good choice if you can find someone who has received specialized training in the care of older adults. This might be someone like a board certified geriatrician. And it just helps to have a specialist because they see more similar patients from one day to the next. So it's not like they saw an infant at their 9 o'clock appointment and now at 9:15, they're trying to help somebody manage multiple chronic health conditions all at the same time. We've also had some questions about finding a great provider for your mental health care. And for this, I would recommend a similar strategy. Of course, you can contact your insurance company. You can ask your family and friends for recommendations. But there's also a really helpful resource we often direct people to. It's an online website called Psychology Today. And on this website, you can find different therapists in any given region. So I used Detroit, Michigan as an example here. And it's helpful because you can not only see a picture of the provider if you're looking for a specific type of individual to help you with these things, but you can also sort and filter by issues they specialize in, the gender of the provider, the insurance that they work with, and all of those sorts of details. So again, that's Psychology Today. Before we close, I want to thank all of the research volunteers in the hospital who volunteered their time to help make our survey possible, as well as my colleagues, Jennifer Fleming, nurse practitioner, and Robin Mazer, geriatric nurse practitioner, and 2 PhD nurses from here at Wayne State, Dr. Folletta Wilson and Dr. Meg Campbell, for their assistance in the project. So now a moment for any sort of questions or discussions. I haven't been keeping up with the chat, so just go ahead and unmute yourself if there's anything you'd like to talk about.
All right, Katie. The way this is set up as a webinar, so everything has to be filtered through the Q&A and chat. So I've got you. I've got you. So a few things that came up. Could you, and it may take a hypothesis,
Sure.
a guess, an educated guess, but what was very interesting, I think, was the note that those that were on opioids were actually scoring higher on the cognition recognition scales.
Yeah.
Do you have any guess why that is? Is that extended having a more familiarity with being a patient?
That was really shocking to us. We expected to see the opposite, to be perfectly honest. The best guess that we have is if you have pain, you're probably going to be thinking more clearly if your pain is treated, even if maybe there are some side effects. And hopefully if the medications are prescribed appropriately, the side effects should be minimal, as opposed to somebody who has a lot of pain and is not being medicated. They probably can't think about much beyond just the discomfort that they are experiencing. That's our best guess. It was a real surprise to us, but that's why we do research, right? We love
absolutely. You do it because you never always expect to get the answers that you do. So another question here, particularly with regards to health and medical language, terminology, jargon, if you will. What would you recommend? Are there any particular sources, whether it be a Wikipedia or some type of a dictionary or something like that? Is there something that can help our everybody to be able to improve the language, just to understand maybe more words or concepts that they may not be familiar with? What would you say to someone who's looking for something like that?
It's a tough question. There are a lot of really great entry-level resources out there, like Medical Terminology 101 book on Amazon. But frankly, I hesitate to even recommend that because I think that we should be expecting our healthcare providers to take that extra second and explain exactly what they mean by a complicated term in the specific circumstance that they're applying it. So if I look up a word in a medical terminology dictionary, it's going to be a real general definition of that term. And then if I'm trying to extrapolate that to my own healthcare and a conversation I'm having with my physician, the physician might be using that word in a totally different context. They might have a different meaning behind it. So I would not ask anyone to take the extra burden of becoming an expert in medical terminology. Instead, I would really encourage everyone to just ask your physician to slow down and help you through it.
And there was one comment here too. I think that's appropriate. There are definitely with your research and your presentation implications both for physicians and for patients. Clearly, this is it's a partnership, right? So I think that point that you bring out carries quite a bit of weight, that we need to take time to really develop those relationships with the doctor, develop that trust, develop that comfort, and really kind of try to do what we can to prepare ourselves for appointments so that we don't run into that fight, flight, or freeze type moment that you get when you're in the, getting a checkup.
So true. I completely agree with that. Absolutely.
Excellent. All right. I'm actually running pretty thin on more questions here. But thank you very, very much for the activities and giving us a little snapshot of what our literacy may be here in this moment. So we greatly appreciate that. Sarah, do you have anything to add?
You did such a great job of answering questions as I thought of them, Dr. Kero. So I usually have something to ask at the end, but you answered everything before I could even ask it. So well done.
And again, to everybody in the audience, if there's any more questions that you have, feel free to throw them in the chat or in the Q&A box, and we can try to get that answered. Also, if something comes to your mind later, if you have that aha moment, 3 or 4 o'clock, while you're strolling about, feel free to send us those questions, and we'll reach out to Dr. Kero to try to get those answered as quickly as he can, because I know, again, fight, flight, or freeze. You always have that great moment just a little bit later.
Absolutely. I would welcome any follow-up questions. Contact me or contact the Electra Lab, or you can get to us through Sarah. I'm sure has our contact info. And thank you guys so much.
Yes, I do.
All right. Thank you so much. All right.
Thank you again, Dr. Kero. Again, if you guys have any questions at the end of this presentation, you can call us 313-664-2616. Just to touch base again on becoming an HBE member, we put on presentations like this every month and sometimes twice a month, and we will be having another one next week, October 27th, and that will be about Medicare open enrollment and what you need to know to get started with your Medicare process this year. Again, that's Thursday, October 27th at 11 a.m. using the same Zoom info from today or the phone number that you used today if you called in. Thank you again, Dr. Kero, for coming out today. This was such a wonderful and rich presentation, and I will probably be rewatching it on our website. And anyone who wants to share with a friend, it will be posted shortly for you to do that. Sean, do you have any last words?
No, I think we're all good. Thank you, everybody, for spending your time with us at our Lunch and Learn here. And we have a very robust schedule, very busy schedule the next couple of weeks. So we also have a Lunch and Learn on November 3rd. And the focus on that will be the health benefits, particularly social emotional, of foster grandparenting. So something a little different, a little out of the box, but we hope you'll join us, and hopefully you'll enjoy the presentations that we have for you. Other than that, thank you very, very much, everybody. Katie, all of our presenters that we had earlier. Thank you so much, and have a wonderful, wonderful day. Stay warm and stay dry.
Yes. Take care, everyone.
Thank you, everybody.